he finished the marionette, and then said, wow, it would be great if this was a real boy. And it was like the media dried out the age. So I thought that was interesting.
Right. So clearly, I think there's information provided with regard to human motivation. What may have motivated him to actually build this marionette. And I think it's explicitly stated, like you said, upon immediately completing Pinocchio, right? So tells us a lot about the creator, tells us a lot about one of the main characters, albeit not the eponymous character, who was Geppetto. Right? So let's focus then on this particular character for Geppetto. Any other behavior, interesting, disturbing, anything else that you want to talk about?
I think if we were talking about Geppetto, I think that we could view the entire film as the framework of kind of his psychosis, if you will. The idea that he has this delusion and visual and auditory hallucination of his wooden doll come to life. So I think that's one framework. Like we've been discussing, so the first thing we always have to rule out is this something that's due to an underlying medical condition or to a substance abuse? He is an elderly male, so he is high risk for having another medical condition. I believe he does smoke something in the beginning, so there's also that. So he has both the medical condition and he has the smoking criteria. So at this point, I'm not sure if it's a true psychogenic experience or if it's one of the medical ESPs.
So, all right, let's reframe this. Now, if we've agreed, or at least initially anyway, our initial interpretation, we're going to agree, is going to focus on the character of Geppetto. And with regard to the behavior I see manifest in this character, the clinician must always consider the direct and physiologic effects of a substance or an underlying medical condition. In the actual movie, and correct me if I'm wrong, there does not appear to be any explicit evidence of Geppetto being ill. However, as you pointed out, in the absence of that, the clinician should not be reassured that a medical condition is not manifesting with behavioral signs given his sex and his age. Both, being male and older, pose independent risk and therefore, in this particular case, cumulative risk. So that's a concern. And along those lines, what might we think? And I think before we even address this, what are the types of symptoms that are concerning to you? And again, I would start off very globally. Is it more of a mood anxiety problem, or do you think it's a psychotic dissociative?
The latter.
So it's psychotic dissociative, all right? So we're going to use those terms in describing Geppetto's Gestalt behavior. That is, his advanced age and his being male certainly confer risk for an underlying medical or neurological condition that we now believe may be manifest as through a psychotic dissociative cluster. So anything in the differential that comes up here.
I guess with, again, this is like a little bit of a detour, but when considering like his age and his like desire to have a child in Pinocchio, I would think maybe mood with psychotic features, because his loneliness could be reflective of a possible underlying depression, and then that transitioning into him having this period of psychosis.
I don't disagree, but let's work our way towards that.
Okay.
Remember, I want to keep you guys on the straight and narrow with regard to this algorithm, because at the end of our micro discussion, I'm going to challenge you with the idea that hypothetically you took notes and that you're going to cross off everything that's explained by everything we discussed, and is there anything left? And it's at that point where you should remind me that because of his motivation, this may have a significant mood component. And that's where we begin to discuss primary mood disorder with psychotic features. But for now, let's stick to this idea that we're dealing with a psychotic mood cluster, since we didn't choose proverbial choice A, mood anxiety. And again, I'm for this question, I'm just remaining incredibly superficial. Somebody who is at advanced age, who begins to behave or talk like this, what might be one of the things we think of?
You mean like a underlying medical condition?
I would opt more for neurological condition,
I think the most common thing would be major neurocognitive decline.
right? I think I heard delirium here too, right? So yeah, I would think of a cognitive disorder. Maybe major versus mild neurocognitive disorder. Must rule out delirium before we actually then decide that this is one of those neurological illnesses, right? So I agree, I absolutely agree. That would be the start of it. On the other hand, let's just say that, and this is just the author hypothetically providing us the information, that is not what's going on. I want to debunk it, so we have more to talk about. First and foremost, let's rule out delirium, and let's say the author told us no delirium here, and that this is not attributable to a major neurocognitive disorder, that condition formerly known as dementia. All right, so we could rule those out just for the sake of continuing our differential diagnosis. Any other observations with regard to this behavior that might further clarify what might be going on?
He had an incredible amount of clocks of all different types. And so when I first saw that at the exposition of the movie, I was kind of thinking like maybe magical thinking a little bit, which could point to like egotypal sort of personality disorder. But we don't have any evidence to assume that he has like a personality disorder per se, because we're seeing snapshots all the time.
Yeah. Yeah, I mean, I don't know if the clocks are supposed to be symbolic. Maybe I'm wrong. Maybe that this is more, or should be directed more towards major neurocognitive disorder, in as much as the clocks may be a metaphor, right? So that's certainly a consideration. In being a woodmaker, boy, there's an awful lot of paint and other solvents. So I'm a little worried about exposure. So this is where we look at his age, and we look at it as a risk factor, a predisposing element, not only to major neurocognitive disorder, but perhaps to a toxin-induced psychotic disorder. I mean, some individuals may be more susceptible to the exposure of such toxins with advancing age. So there might be an interplay here of that as well. Okay. We're not going to talk about inhalant use disorder in the context of Pinnocchio, however. We're going to save that a little later on. Okay. Different Disney film. Any other concerns or thoughts here?
One other thought that I had is like maybe depression with psychotic features, just because he has like a lot of psychosocial stressors, he lives alone, doesn't really have social support, he's kind of elderly, and maybe like his dementia is kind of like exacerbated to the point where he's starting to like have, given his desperation, like psychotic features.
So you think a co-occurring disorder?
Yeah.
So again, I can't disagree. So you guys really want to get away from this psychotic dissociative process, which is fine, the other thing to consider with regard to potential co-occurring mood disorder is that, I think more to your point, maybe this is a primary mood disorder that is representing as pseudo-dementia, right? So that's another consideration too. An individual like Geppetto, who is given a provisional diagnosis of major neurocognitive disorder, when prescribed an antidepressant, has those cognitive deficits resolve. And then we realize as prescribers that this wasn't due to a neurocognitive disorder at all. This was actually a primary mood disorder that responded to the antidepressant, misdiagnosed, in this case as major neurocognitive disorder. So that's a clinical concern too. But before I go to primary mood disorder, there's still something about this film specific to Geppetto, really towards the beginning of this movie, that I think we need to discuss.
I think these folks.
Yeah.
Like, I forgot what it was. It was like, I just remember it was like or I don't think they said what it was.
So anybody jump on Reddit? I mean, there's a lot of subreddits about this. What was in that pipe? Right? I mean, I think if we were treating Geppetto and we got word that whatever it was, an hour or so prior to seeing Pinocchio for the first time, experiencing Pinocchio for the first time, he was smoking something. We would not ignore that, right? And again, it gets to the organic etiology of, in this case, a psychotic dissociative cluster, which again would be a toxin or a substance-induced psychotic disorder. What was in that pipe? And I say this, metaphorically, I mean, or rhetorically. I don't mean for you to give me a specific answer. Right? So he smokes just before going to bed, and then describe to me the scene in which Pinocchio is revealed to be a little boy. I mean, it's really the same scene, right?
I think he thinks he's like sleeping, and then he thinks he's sleeping, so I think he loses in a dream, and then he comes to the insight that it's real life.
Right?
I think there's this component of there being like, I forget the name, like the blue fairy or something of that nature, who is the actual like entity or being that is reviving or giving life to Pinocchio. So kind of that aspect of like having a third party kind of into this nature.
That's exactly right. Okay, so that is the scene that introduces Pinocchio as a little boy. Again, if Geppetto were to present with this chief complaint, what are some of the things now going through your mind? The first is, I think, should be obvious. And were you dreaming? Matter of fact, he actually says that out loud, doesn't he? Doesn't he yell out, "I'm dreaming"? So why wouldn't that be the chief complaint? And why wouldn't the case study of Pinocchio be nothing more than this fantastic dream? I mean, we see him wake up in the morning. We think he wakes up in the morning, but maybe if we look a little closer, it may reveal that he never truly woke up, and the entire plot happens to be a dream sequence. So I think that's a real question to ask to our patient. Of course, if the patient cannot distinguish between a dream state and reality, there's a problem. Right? Now, there are sleep disorders in which that occurs, and maybe Pinocchio happens to be a sleep disorder, or a case study about a sleep disorder. A little bit beyond the scope of our discussion today. But starting out with a sleep pathology would be pretty obvious, since Pinocchio came into being during sleep, right? With Geppetto yelling, "I'm dreaming." So we've got to investigate that. Might there be some combination of what's going on that takes the pipe and the dream state? And in this case, what is in that pipe would be revealed to actually be nothing more than tobacco. So not going, or maybe withdrawing from Reddit, thinking there might be, quote unquote, something in that pipe. What if it is revealed that no, it was tobacco? So what I want you to know is that during dreaming, now again, sleep pathophys alternates between REM and non-REM. So we enter our sleep in a non-REM state, stages 1, 2, 3/4. 3 and 4 delta wave sleep, always combined. Okay. Certainly the first third of the night is predominantly non-REM. The final third of the night is predominantly REM sleep, and that's where there's active dreaming, as well as muscle paralysis, so you don't act out your dreams. Okay, so this muscle atony. It appears that we observed Geppetto during his first REM cycle. And I really don't know how much time goes by, but this is a rather short movie. And if you were to think linearly, it's an awful short time between his falling asleep and dreaming, which means that this may be indicative of a sleep disorder called narcolepsy, right? Where he begins dreaming, he begins REMing during normal periods of wakefulness. In this case, it would be maybe theta sleep, that light sleep. And the combination with him being in twilight, theta sleep, and REM results in these hallucinations. And that would be consistent with, but not limited to, narcolepsy. Again, we're going to talk about sleep disorders when we talk about other films, so I'm not going to pursue this much more, but that's a consideration. During REM, your body secretes a hormone called DMT, okay? Dimethyltryptamine. It's chemically similar, and it's actually extracted from a plant in the Amazon. Right? Anybody know what that plant's name is? Yeah, good, ayahuasca. Okay, it's a potent hallucinogen, a very potent hallucinogen, naturally occurring in the form of DMT or dimethyltryptamine in the human CNS. The peak of DMT synthesis is about 3:30 a.m. So despite him appearing to go into a dream state soon after he falls asleep, maybe that's just Walt Disney Animation needing to speed things up so as to get it into a 90-minute movie. And what we see, and what Geppetto sees in the little boy, Pinnocchio, revealed maybe around the time of 3:30. Now, if taken exogenously, DMT taken orally is usually metabolized very quickly, so that the hallucinatory effects are very quick and not at all long-lasting. That would kind of go against what we're seeing here, because in as much as the rest of Geppetto's life appears to include Pinnocchio, we would expect there to be something else going on. There are two things I want you to know that stop the immediate breakdown of PO or by mouth DMT. Keep it bioactive so it crosses the blood-brain barrier so people can have these prolonged trips. Any guesses as to what two drugs limit the breakdown of DMT peripherally and thus allowing it to get to the central nervous system? One is the monoamine oxidase inhibitor, the MAOI. Anybody want to tell me when Pinnocchio was produced? Can we get a quick 1940s? Okay. Unfortunately for us, the MAOIs were not synthesized until the 1960s. Right? Upon the discovery of anti-tuberculosis drugs, we fortuitously found the antidepressant of the MAOI class. So if we think that this is a primary mood disorder with psychotic features, and maybe Geppetto was on an MAOI, resulting in some interaction with DMT, itself resulting in the appearance of Pinnocchio, that wouldn't be historically accurate. If researchers got their act together and synthesized the MAOI in the 1940s, or if Walt Disney delayed production until the 1960s, I think we'd be onto something, but not so fast. There's one other substance that can actually limit the breakdown and stop the breakdown of DMT peripherally, other than the MAOI? Tobacco. Right? So even though Walt Disney refused to delay the production to make this clinically accurate from the MAOI perspective, they decided to actually write in or draw in his smoking a pipe and using tobacco prior to sleeping. That's really not true, but we'll use that, right? Because now you will never forget that tobacco does enhance the effects of DMT when taken orally. And that might be what this is all about. Now, when we talk about Pinnocchio, and it allows us to review aspects of a drug, in this case, tobacco, as well as dimethyltryptamine, that is not to say that it can't be about a co-occurring in this case, mood disorder versus a psychotic disorder. The psychosis would appear to be addressed with a substance-induced theory. Certainly, if we could get him to stop taking DMT, and of course, we'd want a 70-something to also stop tobacco use. We would pay close attention as to whether the psychotic dissociative cluster also remitted. And if it did, we have our diagnosis. If it doesn't, or if the mood symptoms then reveal themselves, we have to continue our differential. So for the purposes of our getting to the bottom of what is going on in the film Pinnocchio, let's just assume, hypothetically, that upon discontinuing DMT, if he was in fact taking it versus it being part of his natural dream state, that waking dream. And we also were able to get him to stop smoking, right? Tobacco in that pipe. Let's say, because it's what you brought up, he does then begin or continue to manifest depressive symptoms. Single next best step. It's actually fairly straightforward. What would you do with it? Huh? Yeah, right. So here we're going to consider a provisional diagnosis of a depressive disorder, perhaps rule out major depressive disorder, and we would put together a biopsychosocial treatment plan with the bio part of that certainly potentially including an antidepressant. Unfortunately, if I just said that the MAOI wasn't available, guess what? The SSRIs wouldn't be either. But certainly antidepressant therapy, generally speaking, would be indicated here. Whether they were truly available in 1940 is another discussion. Now that's 1960s as well. Nope, TCAs were not available. However, there was a modality that was available. Yeah, certainly in its early history, but still available would be electroconvulsive therapy. And if we in fact thought that this turned out to be an evolving depression, that would have to be a consideration, okay? As well as psychosocial approaches.
I have another, there's another possible etiology as well. I don't remember if he had any like Parkinsonian symptoms, but something like Lewy body with dementia could be something where I think they have like REM sleep disorders and visual hallucinations. I don't recall him walking with a cane or having any kind of physical rigidity, but that's something to consider as well.
Yeah, so the Lewy body dementia, being in the differential area is interesting. Again, we did identify age being an independent risk factor, and one factor that might impact the plot, or at least the interpretation of the plot of this movie. And, you know, in Geppetto's case, so I guess you're making the claim that the marionette turned boy is a visual hallucination consistent with Lewy body dementia.
And he had the REM sleep earlier as well.
Right. Right. And in that case, it would be more consistent with regard to DSM nosology of REM sleep behavior disorder, right? So yes, each of those are consistent with Lewy body dementia. Yep. You know, it's interesting again, you have to get a little bit symbolic here, but in one of the beginning scenes, even before that dream, when he's playing with the marionette, the gait of both the creator and the puppet, not quite shuffling, but it's an abnormal gait. So I wouldn't be so quick to dismiss the physical findings, the movement findings that may be consistent with Parkinson's disease. Right? So again, Lewy body dementia is a form of dementia that is often seen in the context of Parkinson's. We do see an abnormal gait, we see visual hallucinations, we see aspects of REM sleep behavior disorder. All are components of this condition, this syndrome called Lewy body dementia. Yep, so it's another consideration here as well. All right, so again, take-home message, I want you to remember on exams, I would not expect that nicotine withdrawal is going to appear on your exam. It's too easily identified, and I don't think the board is going to want to give you that one question. I will tell you again, remind you, we said this before, it's worth restating, that on the other hand, cannabis withdrawal, and I'm not saying there's anything to do with cannabis in this movie, but cannabis withdrawal looks very, very similar to tobacco or nicotine withdrawal. The major difference is that in nicotine withdrawal, there is weight gain. And cannabis withdrawal, there is weight loss. And that will really help differentiate. Otherwise, it's really a very similar looking withdrawal phase, right? Nicotine versus cannabis. For nicotine, you should know the nicotine replacement strategies. They come in various forms. And perhaps more importantly, the two medications often used, both Chantix and Wellbutrin, which is bupropion. Right? So those do tend to come up on exams. Trying to think if there's anything else we need to review. And of course, the take-home message, especially those who may be listening, for which not a national board, but I will actually be making up the exam. The interaction of tobacco with, especially orally ingested, DMT. The bioavailability, again, remains, and the breakdown peripherally does not occur, resulting in the DMT, that hallucinogen, crossing that blood-brain barrier, with resulting hallucinogenic effects. Again, ayahuasca is a very potent hallucinogen. On the naturally occurring side, we all produce it during sleep. The peak secretion, and it's probably the pituitary gland, is about 3:30 a.m. And whether that's also occurring here is certainly something that's possible. Again, given how we see Pinnocchio following the visit from the blue fairy. Excuse me. All right. Any thoughts or questions pertaining to brief review of nicotine and at least an introduction to DMT? We're going to talk and go back and review DMT when we talk about the hallucinogens. That might be as soon as next week with regard to Alice in Wonderland. All right, I'll have to double check, but thoughts? All right, let's switch over. Talking about the behavioral side of this, you talked about the human motivation, and that led us to think that depression may be playing a central role here as well, especially, again, in the clinical setting. The treatment team, us, decides to initially focus on a psychotic dissociative cluster, but then upon resolution of those symptoms, perhaps because we withdraw the substance, the patient may have lingering or persisting depressive symptoms. So now we're going to pursue this, and that's where the idea of the part of the movie that focuses on his motivation has to be explained. And that may be explained through a depressive disorder. And that also allows us to segue to the next movie, which is PetSematary. Right? So PetSematary has that very similar human motivation. So for those of you who got to watch PetSematary, what are some of the interesting things you want to talk about?
I watched the movie PetSematary, not the older movies. I'm not sure if it's the same.
I think the remake's fine to discuss.
Okay. We'll definitely start with that. In terms of his grief, I think like in the short, acute time that it happened, and how it affects from his, obviously getting the grief, like loss of the daughter is huge, but the psychotic symptoms that followed was very acute, and I don't even know if there is a diagnosis that is made where it's like very acute with the psychotic features. That's for the amount of time. So that was pretty interesting. I don't really know how to classify that.
It's a good point. So individuals, and let's work the timeline, and then ultimately get to your question. Individuals who experience dysphoria upon the death of a loved one are likely to meet with the clinical diagnosis of bereavement. Okay. Bereavement may be a risk factor for developing major depressive disorder. Individuals who have poor social support and who have poor coping strategies are at further risk. Again, thinking along the pages of the DSM, such a major depression, like any major depression, may have mild, moderate, severe, and severe with psychotic feature designations. So an individual who just lost a son through a tragic accident, who now is presenting with a devout belief that if he buries his son's body in a cemetery or in a land behind a pet cemetery, that his son will return from the dead, may have followed that progression. And again, to put that timeline in a 90-minute film would be very difficult. But that's certainly something that might be going on. Now, on the other hand, with such a significant and intense stressor, that death of a loved one, especially when you have the guilt that this father has. I'm sorry, I keep on saying son. I forgot you watched the remake. Sorry about that. The child. Otherwise, everything's pretty much similar. It would not be surprising that they didn't read the textbook and present it in this linear fashion the way we're laying it out today, that they may present with evidence of psychosis much earlier on. Okay? Whether or not we call that truly a brief psychotic disorder or not is really up to how everything progresses, right? If the individual's delusions resolve within 30 days, maybe brief psychotic disorder is a more appropriate diagnosis. But again, the timeline will certainly determine that. Any other thoughts about any? Well, let's stick with the father for a little bit. Again, because he's the modern day Geppetto, right? Longing for his son. By the way, can we work this in reverse order? Any thought then that Geppetto may have lost a son? And that and what we're seeing, he's not burying his son beyond the pet cemetery, but he's certainly building a puppet and thinking it comes to life. By the way, the defense mechanism is called animism. Animism. Animism, on your exam, choice A, normal behavior when age appropriate. And that includes the parent too. When your child falls, you're going to drop to your knees as your child is crying, and you're going to slap the ground and say, bad ground, all right? Even though you're 30-something, all right? So that's culturally appropriate, okay? If you did that in the middle of the hospital, hopefully you'll be rounding with Dr. Aziz and not me. Yeah.
It's a bit of a tangent, but in terms of your mentioning of age-appropriate defense mechanisms, so there was a rural question about a patient who, they were sort of kind of like trying to distract you with a picture of an autistic child, not autistic, but essentially he had an imaginary friend. He then, at the age of 15, is now, they moved to a new town, new school, and he reverts back to his imaginary friend. Long story short, the correct answer ended up being that this was an early presentation of schizophrenia. But it's interesting that you mentioned the defense mechanism, because at first my wrong answer was that he was going through a period of anxiety and stress, and it was normal, but it was actually I was supposed to go down the road like this was actually an very early presentation of schizophrenia.
Interesting. All right.
I guess a defense mechanism like animism, would it, after a certain age, would that fall into potentially showing a picture of early schizophrenia?
Potentially. So I'm going to ask you to send that URL question to me. My interpretation, not having read the question, is that if an individual, a child, is using animism age appropriately, if then they go beyond the age range where it would be deemed appropriate, hit a psychosocial stress, and then demonstrate animism, my first inclination would be to say that they've regressed back to a previous stage and therefore are incorporating a previous defense mechanism, which would be really at the border or borderline of normality. Right? I think that's at the limit of being normal. Of course, we want to address the regression.
Right.
I wouldn't necessarily clinically focus on the animism per se. However, if there's something else going on, and there must be something else in that you world question, that's why I want to look at it for you, and I'll give you feedback, to suggest that there's more going on than just that regression. And because of that, whatever that more is, that perhaps the single best answer happens to be, I guess it was schizophrenia? Yeah. So, how old is the child? 15, all right. So you just send that question to me, and I'll read through it and see if I could pick something out that might be that red flag as to why not simply reassure that this is regression, and then as soon as the stress is alleviated, things should get back to baseline. Back to PetSematary. Any other thoughts with regard to the father? Dad.
He definitely uses a lot of substances as well during, I mean, in the movie, it was his restriction from alcohol and, he's intoxicated, I think, a couple of, things, and that's something, you know, like MDD, but, high risk for, substance abuse for sure. But that definitely adds to his, like, maybe my daddy curious and his, kind of drive to, like, get his daughter back and, the length that he goes to do that, and to, like, normalize her behavior when she comes back, she's like, you know, not the same, but he's still, like, also, despite saying that, no, this is my daughter, and so I think that, like, also kind of, like the delusion was stuck to him, and it's, like, some kind of something that's, like, fixed. It was also interesting.
Yeah, I think with regard to the father's use of substances in the remake, there's a couple things we probably should discuss with regard to the role of substances in this film and then in general. Certainly, we would think that the substance, in this case it's alcohol, would be physiologically supporting or contributing to the psychosis itself. That could happen. On the other hand, you know, it's a combination of percent alcohol by volume, otherwise proof, and quantity. It's mostly beer, isn't it? Yeah. I mean, there are some substances, I think there's 5, that have about 180 proof. So you don't have to drink much to become psychotic, right? He's not drinking any of that, and you know it's beer. So I'm not so sure that the direct physiologic effect is inducing the psychosis, although it's not helping it, and certainly may be contributing to it. On the other hand, if you're looking at the natural progression of depression to more severe forms to include psychotic features, remember I said that, you know, poor social support, poor coping. Well, that's part of poor coping. So in that way, it lends even more risk. So those are the 2 things I'd look out for here, with regard to some physiologic induction, but also some of the independent risk of poor coping strategies, resulting in what then is revealed and we recognize as the delusional belief that in the case of the remake, his daughter's going to come back to life. I don't think alcohol played as much of a significant role in the original film.
In the original film, though, they, I don't know if it's true in the new, but they moved into an old house, and so, like, potentially that goes back to, there's something in the house, substance-wise, that may be contributing to psychoses, because it wasn't just the, male, like, the father who saw, like, mother, I think, also endorsed seeing, like, the guardian apparition.
Yep, environmental exposure, toxin exposure must always enter the differential in as much as any substance or toxin-induced mental disorder has to be in the initial part of our formulation. And anytime any film contains or includes an old house, we've got to investigate. Any other characters in the movie that you think are worthy of discussion? The neighbor? So, and kind of some schizotypal, schizotypal oscillating with frank psychosis in as much as he discloses the PetSematary. Again, if you choose to view this film through the eyes of a clinician and not through the eyes of a horror fan. So there's some aspect of that. He does tend to be a loner, magical thinking, so certainly schizotypal. And whether that schizotypal has actually evolved into a frank psychotic disorder, rule out schizophrenia, we'd have to investigate, sure. Anybody else? All right, we're going to end it here. We're going to take a very brief break, and then for those of you following on Periscope who have received the Zoom link, we'll be providing the case conference immediately after this session. Thank you.